everybody, welcome to my talk today. How do I increase my chances of funding a post-registration nursing course, which can be very expensive nowadays? So hopefully I've got 5 top tips to help you. Do check out my YouTube channel for lots more free videos. It's free to subscribe and I hope you enjoy the talk. So my first top tip is know what you're applying for, and it might sound really simple, but I know many people over the years that have been interviewed for a post-registration specialist course that have no idea of what the course entails and they weren't offered a place. You need to do some groundwork. What does the course content cover? Is the course module appropriate for my professional development? And linking it in with your professional development reviews and your appraisals is very important. Talk to knowledgeable staff and educators for accurate advice. If you're seeking out a course or a module proactively, it's not linked essentially to your specialist area, but you're asking your manager, say for example, to fund a post-registration course in education because you're interested in education, they will want to know what the title is, where the course is being held, how many study days, and what the costing is. So again, you need to do that background reading. Additional tips: when reviewing university websites, make a note of the name, academic credits and costs of module and courses at the time, or bookmark the web page so you can find it. Also check with course leads about linking modules to masters. So you might start with one module, but long term you're thinking about a full masters, and universities can use an accreditation of prior experiential learning, an APEL process, where you can gain credits for past learning and courses. So go through the course leads to check on any prior accreditation. Second tip: know when and how to apply. So you need to know 3 things: how to apply for the university module course, how you are going to fund the course and apply for course funding, and thirdly, how to apply for study leave. And you need to know the deadlines for applications. So knowing who's responsible for your immediate learning and development needs and your long-term professional development needs is important. How are management and educational teams structured? So something to look at as newly registered nurses, and who authorises course funding and study leave. Additional tips: register your requests as early as possible. You might need a formal professional development review meeting, an appraisal, or just to book a one-to-one with your line manager. And find out about external funding and clinical academic opportunities and how to apply if you can't secure funding through your line manager and your employer. Always keep your line manager in the loop, as you might need to request study leave or set days off. So although you can secure funding, it might be that you have to have every Tuesday off for university, and even if it's an online course, you still need some time for studying. And it might be that there's no study leave, you can't have study leave, so you're thinking, right, I'm going to do it on my days off or request annual leave. But again, because managers have to prioritise service needs, they may say, well, actually, you can't have every Tuesday off. Now, most managers will be flexible if you're going to use your days off and annual leave, but you know, if you should try and get study leave where possible. You might get alternative weeks, or you might get a fantastic manager that supports full study leave, but always checking on how you can secure that study leave and that funding is important. Do check out my other video from last week, how do I get funding for a post-registration nursing course, that talks through the different funding streams that you can access, especially if you can't access in local funding for courses. Third tip: align the course to your professional development, and this is so important. Reflect on how the course will develop your knowledge, your skills and your competence. With any application, be it internal through your employer or externally, you're needing to think about how you align to the values of the institution, how it's going to develop knowledge, skills and competence that align with the focus of that institution. If it's a charity, for example, it could be patient-centred care, evidence-based care. How will it benefit the area in which you work, the patients or staff, or inform or influence future practice or our profession? How does the course align with the values of the NHS or the employer or that charitable institution? And where do you see yourself in the future? And how would this course help my career? And by reflecting on those areas, inevitably they will inform a personal statement on your application, or you may be asked those questions in an interview if there's an interview process for funding. When looking at how to inform future practice and plans for the future, it's helpful to look at different career pathways and roles, and I've got some helpful videos on different career pathways, and there may be some tips in there that also might help if you're aiming for one of those roles, or if the educational course you're applying for links to one of those roles. So I've got videos on specialist nurse, advanced nurse practitioner, educator, research or senior nurse type roles. So do check my free YouTube videos out. Tip 4, influencing and informing practice in your current role for a stronger application, and it will also help you at interview to think through how you have influenced and informed practice in your role, because inevitably you're going to be asked questions about why should we offer you the funding? What are you going to do with the funding? How is it going to develop you? And if you've already influenced and informed practice, or you're demonstrating that you're really passionate about an area, it will give you a stronger application and you'll come across stronger in interview when you're answering questions. Two YouTube videos that will help you with this area that you may want to look at: 5 ways to influence nursing practice, and quality improvement and service improvement projects for nurses. So hopefully they'll give you some ideas. Finally, rigorously prepare your personal statement and for an interview. It's a competitive process. Not everybody is shortlisted always, and so don't just do your personal statement as a sentence or two the night before. You need to put some time and effort into your personal statement and for preparing for interview questions. And I have some YouTube videos on that are going to be looking at preparing a personal statement for a funding opportunity and for an interview. Ask people to give you a mock interview if you can. Talk to people who have had interviews previously. I've got lots of tips in my book, How to Prepare for Interviews and Develop Your Career as a Nurse or Midwife, and you can access the book in healthcare libraries quite often as well if you can't afford to buy it. But just make as much effort as you can to prepare for that interview. So finally, try to be realistic and patient as well. There are annual limits to nurse education budgets and limits to staff leave. Apply again if you were not offered the first time, and learn from past experiences and feedback. But also, if funding isn't forthcoming, be proactive and seek out alternative opportunities. And good luck with your attempts at finding some funding. So do contact me if you've got any questions at all. Put them in the YouTube's comment, or DM me on Twitter or Instagram if you just want to contact me one-to-one. So I hope you found that the talk helpful, and good luck with any future applications.